I'm Dr. Srikanth and would like to welcome you to our web seminar on weight loss surgery. Our practice is devoted exclusively to laparoscopic weight loss surgeries of all types, such as the sleeve gastrectomy, adjustable gastric band, gastric bypass surgery, duodenal switch, as well as revisions. I have performed over 2,600 weight loss surgeries over the last 9 to 10 years and 1,700 laparoscopic weight loss surgeries. Our goals today are to educate you about who qualifies for weight loss surgery, the process as it pertains to our practice, understanding the various types of weight loss surgeries, and our aftercare protocol, and some special issues. Here's an example of 3 sisters who each chose to have a different type of weight loss surgery within a few weeks of each other. 15 months later, they each lost a whole person, demonstrating how patients could achieve spectacular weight loss irrespective of the type of operation they choose to have. Morbid obesity is a disease of energy imbalance that causes an excessive accumulation of energy as fat, resulting in numerous other diseases which are called comorbidities. This condition could result in premature death. It is a chronic, genetically determined, and environmentally dependent disease. When obesity reaches a point where it causes serious medical conditions, it is called clinically severe obesity. This is defined as a person with a body mass index of 35 or greater. It is no mystery that serious health conditions are a direct consequence of obesity. Although people at large are aware that blood pressure, diabetes, sleep apnea, and heart disease may be directly related to obesity, few people realize that obesity could be a very important cause of infertility as well as depression. Obesity and diabetes are very closely related. Only half the patients who have diabetes actually know that they have diabetes. The relative risk of developing diabetes rises astronomically as patients get heavier. Diabetes affects every part of the body: the brain, heart, nerves, kidneys, blood vessels. Nothing is spared, and so every effort should be made to try to avoid it or control it. Diabetics have a higher risk of developing heart attacks. Metabolic syndrome is a condition that is very similar to diabetes and occurs in obese patients as well. If you have any 3 of the following 5 criteria, you should consider yourself as having metabolic syndrome: a waist circumference over 35 inches, blood triglyceride level over 150 milligrams, good cholesterol level less than 50, blood pressure that is greater than 130 over 85, and a fasting blood sugar greater than 110. Obesity increases the risk for several cancers 3 to 5 times above baseline for patients with normal weight. BMI, or body mass index, is a ratio of a person's weight to their height. If this number is greater than 35, as shown in red, you're a candidate for weight loss surgery. Ideal body weight is a statistically compiled weight that correlates with the least risk of death based on a person's height and sex. There are several ways to assess outcomes after weight loss surgery. Percent excess weight loss is a number that could help you make this choice. Genetics, as well as increase in portion size and consumption of calorie-dense foods, leads to obesity. The body seems to remember its heaviest weight, and every time a person diets, they lose some weight. But once they quit dieting, the body regains this weight plus a few pounds. This phenomena is called set point and explains why diets don't work. Most Americans consume roughly about 2,000 calories per day. This translates to about 10 hours of walking in order to maintain energy balance. This is something that's impractical in an urban setting and explains why exercise alone is inadequate to provide sustained weight loss. The body seems to manage energy very tightly. If one consumes 100 calories more than what they can burn off that day, every day, for example, by drinking a glass of apple juice, that person would be 10 pounds heavier at the end of the year. Once your body mass index goes over 35, surgery is essential to control obesity.